What are the signs and symptoms of typhoid fever? So, signs in typhoid fever will manifest between 7 days to 14 days of after the ingestion of contaminated food or after drinking contaminated water. And patients will present with the following complaints. One, they will present with a history of diffuse abdominal pain. Two, they will present with a history of fever, which is ranging from low grade to high grade fever of about 39 to 41 degrees Celsius. Three, some patients might present with a history of constipation, and others will complain of diarrhea, which is foul smelling, yellow to green in color. Uh, Five, other patients will present with a history of bloating, in other words, abdominal fullness. Most of the time, they will tell you that they just feel that the abdomen is full, and that symbolizes that it's full of gas. Another thing, the patient will present with a severe headache. They will come in with a history of severe headache. Others will complain of joint pains. And others will also say that they are experiencing excessive sweating, especially at night. And others will also complain of chills. So these are the symptoms of typhoid fever. And then let me also talk briefly about the signs. The signs will be the patient, when you inspect, the abdomen will be distended. Some will be able to see rose spots on the trunk, that is the chest and the back. On examination, still you'll be able to feel that there's an enlarged spleen. Also, on deep palpation, also you'll be able to find that there is a generalized tenderness on the abdomen. And then in the eyes, you'll be able to pick jaundice. You'll find that there's a yellowing of the eyes. So these are basically the signs and symptoms in typhoid fever. Because as we said earlier, that typhoid fever is a multisystemic infection. So it affects most of the organs in your system, ranging from the brain, to the liver, to the intestines, and even to the spleen.